Today, we're going to talk about this framework which we use sometimes in substance abuse, which is SBIRT and frames. So think about like a patient, let's say Alex. And Alex is a patient who is having challenges with possibly you think that he is at risk for engaging in alcohol use or alcohol abuse. How do you address this with him without alienating him? This is where this approach comes into play, and you want to make sure that you're screening. SBIRT stands for screening, brief intervention, and referral treatment. So, screening, brief intervention, referral to treatment. So the goal is like you're identifying risky behaviors. So through standardized or like audit or any tool, which is a scale, like a screening test, to you can ask him to fill out a questionnaire. His responses indicate like what patterns or things like that. Sometimes it indicates that it's risky on the weekends, and then you create a brief counseling session. If it needs, then you go to treatment. So, uh, like the idea is that you take a stepwise approach and you take a non-judgmental approach and you involve the patient in filling out forms and them self-disclosing some things. And then you, based on what you're getting, you're going to refer to treatment. So in a frames model, it consists of six modalities where you're giving feedback, where you are giving non-judgmental, clear feedback of risks of current behavior. Let's say that Alex, based on the questionnaire, your drinking puts you at risk for liver damage and mental health issues like depression. So that could be the feedback you can give. Now, responsibility, you can say that um, ultimately he's responsible for those decisions and changes. So you can say something on Alex, you are the one who are in control here. No one can make these changes for you, but we are here to support you. That would be some, uh, you know, level of responsibility and how you advise him. And then what advice can you do is that you can recommend reducing drinking to no more than 2 drinks per day, or decreasing or finding a new hobby or replacing the behavior. That's the advice you can give. Now, menu is that you can give him various options for behavioral change like sports, counselor, other new hobby, things like that. And you're always using empathetic interviewing, and then you also uh, talk about like self-efficacy, means like building patients' confidence in ability to change. So what I want you to take away from this lecture is that these are frameworks which you could view or look at and learn to prepare to engage a patient who you think is at risk for substance abuse or behaviors which you think that require non-judgmental structured approach, which make sure that you're covering all the aspects of evaluation and the care delivered. Okay, thank you.